I wanted to talk to you a little bit today about something that we've been seeing a big increase in our office since this pandemic, and it's gum disease. Unfortunately, since the start of the pandemic, even some of our patients who we would consider to be very meticulous about their oral hygiene and oral health have seen a decline in their gum health. Some of you might be wondering, how do I know if I have gum disease? The most important thing is that you get the checkup done so that you can ask your dentist or dental hygienist about the status of your gums. But something that's happened through the pandemic is people are overdue for their standard dental cleanings. In the absence of a professional dental cleaning, the plaque will build up in certain areas. The result of that is the bacteria start to irritate the gums, and we start to see some redness and some bleeding. Occasionally there'll be pain. Interestingly enough, gum disease is not usually painful until the very late stages. So that's why it's most important to get checked out by your dentist or a dental hygienist. Some of the symptoms you can look out for are bleeding when brushing, bleeding when flossing, sensitivity to the gums when brushing, and sometimes bad breath. If the gum disease is allowed to progress, it can be expensive and difficult to manage, or even lead to tooth loss. Now, because we know that some patients won't even be aware that they have gum disease, we want to recommend that at least once a year, you come in for a checkup. Now, the good news is, even if you haven't been to the dentist since the pandemic started, we'll probably be able to take care of you with some very basic services, and your gums will return back to health quickly and easily. So whether you're 6 months overdue or several years overdue, please call our office and we'll get you back on track.